All right. Good morning, good afternoon, and good evening. We are so excited to have you today. Today is, depending on where you are in the world, it could be Wednesday or it could be Thursday. And today we have webinar 3, FIP webinar, Responding to the Pandemic Together, Remote and Online Education in Trying Times, Sharing and Learning from Each Other. This webinar is delivered by FIPED, and that constitutes FIP AIM, the Academic Pharmacy Section, the Workforce Development Hub, and IPSF. My name is Toyin Tafade, and I'll be moderating the session, and I'm really excited to be with you today. We had a record-breaking registration for this webinar. Over 1,000 people were registered. We'll see how many are able to join us. Thank you again for your interest. These are unprecedented times, and we're so glad to serve you. Welcome. For we know that FIP has been running several special webinar series on COVID-19, and the aim of these webinars are really to serve you, to share discussion strategies, provide information, describe implications, innovations, and approaches, and to engage our frontline workers and the pharmacy workforce. Our hope is to discuss all the implications of the pandemic and consider some of the impact of the disease, and then assess and discuss the evidence based on what is available to us. Make sure to let Lena know if you have any ideas on webinar topics, and you can reach her at lena@fip.org. Email her and she will be happy to respond almost immediately. We also have important links and resources on FIP for you that would benefit in terms of whatever questions that you have. There's the COVID Information Hub. There is also a link at the FIP.org coronavirus, and there's a Facebook group that you can participate in to get additional information. In case you're joining us and you have no idea about what FIP is about, FIP is the International Pharmaceutical Federation that serves and represents 4 million pharmacists and pharmaceutical scientists around the world. Its mission is to improve global health by supporting the advancement of pharmaceutical practice, sciences, and education. FIP's vision is a world where everyone benefits from access to safe, effective, quality, and affordable medicines and pharmaceutical care. FIP was founded in 1912 in the Netherlands, and we're so excited to be a part of a great organization that is willing, able, and ready to serve all the pharmacy and pharmaceutical scientists around the world. A little bit about the institutional membership, academic institutional membership, otherwise known as AIM. AIM actually is the only global network of academic pharmacy leaders. 160 pharmacy and pharmaceutical sciences schools from 55 countries are members of this organization. Perhaps you're not a member of AIM. We're asking you to join by sending a note to aim@fip.org. We do have programming that is coming up in September, the Lord willing, right, in Seville. And so we encourage you to register for the Global Academic Leaders Forum in 2020. The link is there for you, and we have a suite of programs that is already available to you that you can participate in. Serving you through the academic institution membership as a number of colleagues and advisory committee members from several regions in Africa, the Americas, Europe, Southeast Asia, Eastern Mediterranean, and Western Pacific. Contact any one of these individuals and they will be happy to answer your questions that are related to membership in AIM. And I want to let you know that we have our fearless leaders, Wayne Heinmarsh and Pierre Moreau, who also are leading this group of folks. And in our meeting is where the idea of this particular webinar actually came up. For today's webinar, we know that you have lots of questions, and we're asking you to please put your questions in the chat feature so that we can address them at the end of the webinar. We will be recording this webinar, and you can access it freely at fip.org/coronavirus. And we look forward to feedback from you at webinars@fip.org. At this point, I am going to turn it over to our fearless leader, Sean Gleason. She has done a fantastic job of collaborating with and coordinating and planning this particular webinar, and it's an honor to be able to turn it over to Dr. Sean Gleason.
All right, thank you, Dr. Tafade. As she mentioned, I'm Sean. I'm with the University of Colorado, where I'm an associate professor and the director of our distance degrees and programs office. I also serve on the Workforce Development Hub's Workforce Development Goal #1 group as working on academic capacity. So with that, let me see, do I have the mouse toying? There we go. All right, I want to give a special thanks to our co-organizers and planning committee. It's important you all know this has definitely been a collaborative effort with leadership, guidance, and great discussion put forth by all those listed here, and importantly noting all the different groups that are represented from FIP AIM, the academic pharmacy section, the Workforce Development Hub, in particular the Academic Capacity Group, as well as our student group, IPSF, and of course, all panelists that will be joining us today. So, oops. My mouse got ahead of me. Our learning objectives for today are at the end of this session, participants will be able to discuss the differences between remote and online education, noting how each can be applied under current and hopefully future conditions. We will share remote and online methods to provide both knowledge and skills-based content and formative and summative assessments. We will discuss implementation tips, challenges and rewards in providing remote and online education, considering importantly student, faculty, and regional differences. We have 6 faculty panelists joining us today and 1 student panelist. We're hoping she's able to log in soon, but let's start with our faculty panelists. First of all, Dr. Vivian Mack is joining us from the Faculty of Pharmacy and Pharmaceutical Sciences at Monash University in Australia. Her specialty is in the assessment of pharmacist skills through simulation, and in particular OSCEs. And I think many of you may be aware of the simulation program offered by Monash MyDispense, which is where her expertise is. Her email address is her name, vivian.mack@monash.edu. Next, we have Dr. Rebecca Moles, who is an associate professor at the University of Sydney in Australia. She also brings to us expertise in OSCEs and a variety of applied online learning methods. Another OSCE expert is Dr. Sarah Schooler, where she is from the University of Colorado and is an assistant professor and the director of our Pharmaceutical Care and Learning Center. She has done an excellent job of developing OSCEs and in particular has an expertise in the use of standardized patients in the OSCE environment. Dr. Vibhu Solanki is an associate professor at the University of Nottingham in the UK. He brings to us expertise in simulation, gamification, virtual reality technologies, and also hopefully we'll be sharing some important perspective in summative assessments and differences in these trying times among our students and their capabilities. Dr. Eunice Carode is an assistant dean, associate professor, and the director of distance degree and external programs at Howard University. He brings to us 20+ years of pharmaceutical care and distance pharmacy education. And our last faculty panelist is Dr. Daniel Moraga from the University of Valparaiso, Chile, as well as the University of Texas at Austin. He also brings gaming experience, but importantly, using your phone in class. And that's important to us during these trying times when sometimes the internet may not work so well. He also has experience in using open source software for researching online methods. Again, important during these trying times when we're trying to find cost-effective measures. And then, oh, good, I see Ella has joined us. Our special guest is Emanuela Nezaribe, who is a final Doctor of Pharmacy student joining us from Kwame Nkrumah University of Science and Technology in Ghana. Ella is a Regional Relations Officer for the African Regional Office of IPSF, and I have the pleasure of working with Ella as an IPSF mentee. Importantly, she's also the contact person for the Ghana pharmaceutical students, and she has a goal of getting involved in FIP and other organizations. So with that, I am going to turn it over to Ella so she can share her experience with us. So Ella, if you can find the unmute button, it's the red microphone, hopefully can be turned to green. And you can share your experience with us.
Okay. Hello, everyone. I hope everyone can hear me. Good. It's afternoon in Ghana, so good afternoon. It's my pleasure to be here. So quickly, I will run through my experience as a pharmacy student during this COVID-19 times. So basically, as a final year student, I have been able to, we're told to stop going to the hospitals because of the cases that were being recorded in the country. So basically, for 2 weeks now, we've been introduced to virtual classes. So every year in the pharmacy, every group, they've started the virtual classes where the lecturers send in the slides to the students, and every student is able to access the slides and the learning materials and every other thing that is required for the course. And then we are expected to read, and then later on the lecturer comes in to answer any questions that we don't understand. And then also in addition to that, because as clinical students, I'm in my final year and I'm currently in the hospital. That is where I do my clinicals. Because of that, we are not able to get the hands-on experience that is expected of us. So, so basically, we are all indoors. Everyone is indoors because of the lockdown and all of that. And then I also during this period, I was able to collaborate with medical students in my faculty. And what we did was that we tried to go around speaking to people about COVID-19, because apparently not everyone is aware of COVID-19. And so what we did was we went around to places, we went to the marketplaces, we spoke to people about COVID-19 and to um, how to what do you call it? So how to stay safe. So basically, we went to hospital, went to radio stations, and that's how they will have to wash their hands, how they should wear the nose mask to prevent contamination or cross-contamination as well. And also at the radio station, one basic thing that I did as a pharmacist was to talk to them about the drugs. So we know that chloroquine and from the whole, it's been said that chloroquine and azithromycin works, but then we see people trying to take these medicines even though they haven't been diagnosed of COVID-19. So we talk to them about these drugs not being, they shouldn't be able to access them. They shouldn't even try taking them, but rather stay at home to prevent themselves from getting infected. So basically, we've been able to actually learn and also at the same time impact people during this time. So yeah, this has been my experience so far as a student. Thank you very much, Doc.
All right. Thank you so much, Ella. Wow. You guys are doing quite a bit there. We really appreciate you sharing your student perspective and importantly, showing us the resiliency, professionalism, and growth that you all are continuing to show even in these challenging times. And we look forward, Ella, to hearing more about your perspective as we go through the panelist discussion. But amazing work you all are doing there, and thank you. So with that, I am going to begin our panelist discussion. We do have planned questions that have been designed by the planning committee based on what we've heard and recognized maybe some of the most important topic points, largely getting at assessment techniques. But please do also share your questions through the chat board, and when we get done with the planned questions, we will go back to your questions, and there's already been some discussion that perhaps we might end up having a second session for this. So before we get started with the questions, one of the topics that we had been discussing as a panel was the importance between remote and online education. And this is important because we're all beginning to venture into what is technically remote education in response to these extraordinary circumstances. Yet it's important to understand the differences. In general, it gets to the delivery method, and then we'll talk about assessment. As far as delivery goes, what a lot of us are doing right now is considered remote education or remote teaching. And in general, the best way to think of this is remote education is synchronous. A large way that we have been doing this is through web-enabled face-to-face learning. And oftentimes, as we're experiencing now, this is done in response to a need for rapid deployment. It can, of course, be used in regular times as well. But what we're all doing mostly may be considered remote education. In contrast to that, online education is more asynchronous learning, and it's what a lot of us that provide online programs have the luxury of doing and have been doing for quite some time. And it allows us to have greater planning time, both in instructional design and importantly, in student and faculty support. So there are some nuanced differences between the two, but also there is definitely some overlap. But it's important to understand the differences of these, especially as we all begin to share our experience through these extraordinary times, that we consider what we're going through now, and that it may have been what we're sharing may have been in response to these emergency settings. We do have two wonderful articles that talk about the differences between the two. We will share these at the end of the session and on the website, and you can see links there, but there are two articles that speak to these differences, and we'll be speaking to the differences throughout these, or sharing experience with all of them as we move on. So with that, I'm going to move on to our first panel question, and I am seeing a different slide on there. I will go ahead with the first panel question, which is related to application-based assessments, or OSCEs. And Dr. Moles, I believe this will be directed to you, but Dr. Moles, how can we assure that academic integrity in our remote OSCEs can be assured when our environment for offering them has greatly changed?
Yeah, so thank you, Sean, for that question. So hi, I'm Beck, I'm from Sydney, and I want to share with you what we've just done. Actually, today and yesterday, we ran a full practice OSCE exam with our 50 MPharm students, and we weren't sure how it was going to work via using a Zoom platform to run an OSCE exam, but actually I'm very pleased to announce that it ran perfectly. But some of the things we've very much thought about is, how do we know our students aren't cheating? Because, you know, now they're in their bedrooms or their studies at their home, and how do we know they don't have somebody next to them, they're not texting their friend to find the answer? What can we do about that? So actually, we thought long and hard about it. And in fact, we actually thought, well, what are we trying to test in our exams? And so in our particular OSCE at Sydney, we run it in the third year of the B Pharm degree, but we also run it in the second year of our M Pharm degree, which is about equivalent, and we have a 4-year degree. So it's sort of a semester or a year before the end of your degree, depending on its length, but it's towards the end. Anyway, we have a OSCE that involves the pharmacist having to speak to a doctor about a clinical situation and answering a doctor's question. We have an OSCE station that involves speaking to a patient, and usually that involves explaining something that's quite complex but in easy to understand language. And we have a third station where they actually have to speak to a pharmacist colleague, and this is where we're actually able to look at whether they really truly understand mechanisms of action of drugs or structure activity relationships. So quite scientific principles, but can they actually, like, do they really understand it, or have they just learnt the slide from their med chem lecture off by heart? So in this exam, we used to give the students, when you're face to face, we gave them an hour of preparation with these 3 sort of stations in mind, with a very short time to prepare. But when we thought about, well, how are we going to do this online, we actually thought about it long and hard and went, well, why do we do that? Why don't we just give them a range of cases and they could randomly be tested on 3 of them? So in fact, what we're going to do for our real exam coming up in June is we're going to give our students 18 cases. We ran a practice today and yesterday where we just gave them 3 cases to prepare, but in the real exam, we will give them 18. So what we're doing is moving it from preparing within 1 hour to having a week's preparation. But you still have to in-depth learn about 18 cases within that week, which I'm actually very excited about because I know assessment drives learning, so I think our students are going to learn more. But how do we know they're not cheating? Well, we think, yes, they're going to cooperate on preparing for those 18 cases. And then we thought, well, does it matter? Well, maybe not. If you've learnt the information or the material, maybe it doesn't matter that you've collaborated on preparing for those 18 cases. You have no idea what exactly we're going to ask during the exam. Now, by having 18 cases, it means the students can be randomized to any 3 of those. So the chance of me and my best friend as a student getting the same 3 cases is pretty low. So I have to learn all of them. Even if my best friend has their case before me as a student, it's unlikely I'm going to get the same one. So even if I call her straight after her exam, I may not know what happens. During the exam, we have the 3 examiners on the Zoom chat in the room. So we actually get the student to show their student ID so that we know it's them. We get them to hold up their computer or webcam and move it around the room so that we know that there is nobody else hiding in the room. The exam is recorded. There's 7 minutes per station. It's very difficult. We did the practice yesterday and today. You can tell if they're allowed to look at other materials. It's an open book exam, so we're not worried about that. But there's no way they could be texting their friends during that and trying to find out the answers. There's just not the time. And with 3 examiners, if you like, in the room, even if it's via Zoom, we're pretty sure they're not cheating. So I'm very proud to say that within a very short time, we turned our exam around from face-to-face to online, and I actually believe that it's going to test the student learning, even deeper learning than it did originally. So I think that's enough from me.
Wow. Excuse me. Thank you, Rebecca. That's so interesting. And I love the part, like you said, by preparing for these 18 cases, they're learning along the way. And at the same time, with the randomization and other techniques, you're able to assure that it is the student in question. So sometimes just kind of letting go and using what you have can lead to a positive outcome. So thank you for that. So next, still related to OSCEs and application-based assessments, I'm going to ask Dr. Mack to share with us what are some creative methods that you've used to provide your OSCEs in a flexible manner, and in particular, flexible meaning in the face of reduced internet bandwidth. So Dr. Mack, could you share your expertise with that?
Thanks, Sean. That's really a great question, as being flexible is really key during this ever-changing climate, I guess. Online OSCEs, as what Beck was saying, can be conducted with various video conferencing tools. But the complexity with synchronous OSCEs is around managing diverse learner needs. And to share our experience at Monash University is that we converted one of our OSCE stations to a video recorded submission as an asynchronous OSCE, which meant that students and even staff, as you've mentioned, Sean, have greater planning time. And asynchronous OSCEs are useful when learners live in multiple time zones, which is essentially what we're experiencing now, with the majority of our international students now having gone overseas back home. We also felt that it was really important to address equity issues with poor internet access or inability to log into video conferencing tools. It also reduces the pressure students may face when everything fails with live OSCEs. As you know, OSCEs are already very high pressure situations for students. So it may not work for all types of OSCE stations, but we selected one that wasn't problem solving focused, but more of a focus on assessment of oral communication skills. And it was a health literacy task where they had to educate someone on the importance and how to use a medicines list, which is an important skill to have essentially in this current time. They had very clear instructions, including the case stem for the station. And the question we get asked a lot is about the idea that students are able to redo this task multiple times before they submit the assessment. But we felt that even though students are able to record multiple times and submit the best submission, because who wouldn't want to, this also meant that they're actually practicing as many times as possible before submitting the version that they want to. So we all know that practice helps them learn and also improve on their skills. So we see this as a positive learning experience overall, without the stress and pressure of going online and doing things live. Interestingly, the students also got their family members involved because they're either in isolation with their family members. But even for those who are living overseas, it was a great way for them to connect with their family members who are actually living overseas and they're not able to see them. But you could also see the pride that some of the parents had when they're doing the task with their kid, seeing that they were in isolation on their own, and that the child being able to do the task was essentially priceless for us to see. And for students who were doing it in isolation on their own, they were able to do their task via Zoom or Hangouts. And it was a great opportunity for them to learn about telehealth during these times. So we felt that overall it was a positive experience using video submissions. Overall, we had 200 submissions. Essentially, we had 200 new members of the public who now know how to use a MediList. So I think that's a positive thing overall, and students didn't feel very pressured to undertake that OSCE.
Wow, thank you so much. I can tell you that I learned from you sharing this, and I'm actually implementing the recorded feature in my course starting tomorrow, and a large part of that is because of the flexibility for the asynchronous method, and our students just being overloaded with work right now. So thank you for that tip. I love it, and I love the practice aspect of it. So now I'm going to continue on to our last question on OSCE-related topics. And I'm going to ask Dr. Sarah Schooler from the University of Colorado if you could just share your thoughts and recommendations for the use of standardized patients in OSCEs.
Hi, everyone. Thanks for having me. It's great to be here. There's actually a great article, if you guys want to check it out, by Smithson and colleagues. Looking at it, it's an integrative literature review that really looks at standardized patients in pharmacy education and currents in pharmacy teaching and learning. And one of the things that it really brings about is standardized patients are awesome for student learning. Their students are typically unfamiliar with them, so it definitely offers a more believable, authentic experience. A lot of times they're less intimidating as well. And then they can really provide valid feedback on the patient experience. And we are also running virtual OSCE. And what I have really noticed that has been truly beneficial in this time of COVID is that when we have so many faculty that are working almost double hours, depending on if they're in clinic, if they're seeing sick patients, if they have to report to the hospital. We have a lot of flexibility in our scheduling of our standardized patients. And so we have had them within the Zoom rooms for these OSCE-like experiences. And I've actually been able to cut my exam time in half because I'm able to pull in more standardized patients for that. One thing that I will mention is that they have seemed to need additional training in Zoom or any kind of online communication platforms. And so we make sure that we run practices with them, making sure that they feel comfortable in that environment. If you don't have access to using standardized patients, faculty can also be used for this. And then you can also use peers, so student to student, which we've done for practice sessions as well to allow them to practice.
Wonderful. Thank you so much, Dr. Schooler. I really like the suggestion of the article in Currents in Pharmacy Teaching and Learning, as well as that useful tip. If you do not have standardized patients, others can certainly be trained to fill in that role, whether it's faculty members, peers, or even other team members such as instructional designers have been used. So thank you so much.
Mm-hmm.
All right, so we've talked a lot about application-based assessments. So let's now go on to knowledge-based assessments, whether these are formative or summative. And academic integrity continues to be a topic of interest. But what are some other ways that we can assure that when we're addressing knowledge-based assessment? And so, Dr. Solanki, I'm wondering if you can share your experience, especially in these times when there may be inherent differences in our students' experience and capabilities.
Thank you, Sean. Good afternoon from the UK in Nottingham. With respect to some of the challenges that we experienced, there was a tremendous amount of difficulty around equity and also accessibility. And as a consequence, when thinking about the assessment methods with respect to these challenging times when your students are all of a sudden flung across the globe to 26 different countries right across the globe and across multiple time zones, that does produce a lot of challenges. So more immediately, a synchronous form of remote learning was undertaken by the University of Nottingham, and that itself brought about some of the challenges that informed the way in which we were going to go ahead with regards to assessment. First thing to think about more immediately was student capability with regards to using online hardware and software, their accessibility to an actual computer hardware or software, also their internet access and the variability based on connectivity across the globe. Then we had issues around thinking about teacher capability in terms of the academic and their capability to use the actual programs that we were intending to potentially use as part of an online assessment method. And then there's issues around online security and user honesty, which we've already heard about from some of my colleagues. So with all those aspects in mind, it does create a bit of an issue around potentially thinking about online assessments, and there's been sort of great examples of ways in which it can be successful. In Nottingham, we decided, in terms of this particular time zone that we're in at the moment, not to go down the route of online learning and move towards more of a asynchronous coursework style learning, where the students would submit online a coursework based answer to some of the problems that we had, as well as in the future potentially looking at some of the options that have been mentioned already around video consultations, or once again delivered in an asynchronous format. On the flip to that, with respect to our 5-year integrated degree program, we have looked at potentially bringing the students in a synchronous format online, purely because of all those students have been available in the UK, and for us being able to assess the connectivity of those students, and as a consequence, those students, like other individuals that have expressed what they have done, they will prepare together, listen to each other's answers with regards to what's going on, but eventually and essentially answering the question and being assessed on their particular question only. But I'm sure many of my colleagues have also experienced at this point in time, especially around this COVID situation, real difficulties in pursuing their original assessment methods outlined at the beginning of the year.
Yeah, indeed. I'm sure that is the case. Thank you for sharing your creative ways of addressing it, and most importantly, being respectful to the inherent differences that are being experienced by our students. So thank you. All right. Moving on to formative assessments. We have a wealth of experience on the call today. And so I'm wondering if Drs. Moraga and Kuroda could just share briefly some other methods that you've used to assess your students in this online and or remote environment. So Dr. Moraga, I'm wondering if you could really maybe tell us about gamification or your open source software.
Hi, everybody. This is Daniel from Chile. Well, it's a really interesting situation. We have been doing this before the COVID-19. The gamification, it's a chance to engage with your students, and this did work before doing regular lectures, but now it's even more important when I bet everybody has been in a class giving a lecture, and they don't know because we don't have webcams. So we don't know if the student is in the other side. So sometimes the silence may be a problem. So what we use is Kahoot. It's an app that allows us to create questionnaires. The students can answer those questions in like during the class, and the report, it's an instant report that you can get online. So we show that report to the students. In that way, you can assess if they are actually getting the idea of what you are trying to explain during the class, or if they are actually getting everything, they are getting confused. This generates kind of different environments. One is that they think that they are playing a game, and they are competing each other. So that makes them, they engage a lot with the class, and they are trying to actually beat their the other students. So that is really good because they are actually trying to learn, and they are not, and so they are actively doing that.
Wow.
That's from the side of the gamification. And and the other with the open source softwares, what we do, it's this is a class that we are giving right now. We modify our master's degree lectures to the online, which is new, but has been great because we generate this new class that allow us to train graduate students about open source softwares to get data during your computer. So we call it my computer, my lab, because they're actually, even if they are at home, they can generate data. So we trained them in maybe 7 different softwares for image analysis. Oh, I should say that I'm in the pharmaceutics department, so a little bit far from your experiences. But so we get these softwares, we train them on how to get data from different papers, so how you can extract data from publications and make like new figures for reviews, for review papers, stuff like that. That's kind of yeah.
All right. Wonderful. Thank you so much. I think the thing that's really nice about gamification is even though you were using it prior to this, it is really a wonderful source that we can use in these times when internet may not be as well, because it's right there on the phone, which most of our students have, and cell connection is typically still very good. So another excellent way to continue to provide education in this time. interest of keeping us on time, I'm just going to summarize real quickly what some of the points were that we should consider in regards to online proctoring. Online proctoring systems for exams there are some open source products, and then there are some products that you have to pay for. And so that's not always feasible. And so some of the discussion that was going on among our panelists is to really consider, is it always needed? Is proctoring always needed? And we heard some examples from Dr. Moles and others of ways we can alleviate that. So I guess I would just ask everyone, when you're considering either a formative or summative assessment, and you are thinking about academic integrity and online proctoring, to think about, are there other methods that you could use, such as those that have been shared by our panelists today? Next, I'm going to move on to some really important topics. And this slide is entitled Potential Inequities. But I think what's important to note is that these inequities are occurring during these exceptional times in really all regions of the world. And I can speak for myself. It has occurred to me right here in Denver, Colorado. And there are a number of things that are going on related to this. And I'm going to ask Ella if you can open up your mic soon, because one of the things I think that we all have talked about quite a bit is internet access. It has been a problem everywhere. So one of the questions that I think we're all wondering is, how can we still move forward with our education in the face of limited bandwidth, internet problems, etc.? And so Ella, can you remind us how your school has addressed this with some of your content?
All right, thank you so much, Dr. Blessing. So with the terms of the internet access, I think one thing that my school has done so far is to actually provide students with internet. So for even in school, we still have international students who were not able to go home during this period. They are just staying in the hostels that are being, in the international students hostel. So I think what the school actually did was to provide, make sure that there's constant Wi-Fi, constant internet access for the students that are on campus. Then for those that are at home, we through the mobile phones, we have the school SIM card, which everyone has access to. So what they did was to increase the number of data that is being given to each student per month. So usually it used to be 2 gig, it was increased to 5 gig for every student, so that way they wouldn't have to, they would be able to access the online courses that they have to. So that's one way that our school tried to tackle this issue from
Wonderful.
our side.
Okay, thank you. While I still have you on the line, I'm going to jump to the third bullet point, which talks about student and faculty life considerations. So I'm wondering, Ella, if you could just share some challenges that you've encountered, and how have you been getting through it? And maybe it's some of what you've already mentioned.
Okay, so I think one major issue that we had was, having to having the internet access, which I had said earlier that our school tried to also tackle that. I think another issue that we have also experienced is, trying to focus. When you are in school, when it's the face-to-face thing, there is that focus. You know that, okay, I'm in the school environment, so there is this energy that comes with it. So when you are at home and you are sitting by your bed and you have to work on this, you have a course to attend and all of that, it's sometimes it's difficult focus. Yes, exactly, especially from the external factors. So basically, for me and a few of my colleagues, what we try to do is that, when we wake up early in the morning, you have to attend to this course around 10. So at least you try to get dressed, try to eat breakfast, I mean, have everything in check, have your laptop, have every accessory that you need by the table. You sit down, and once it's 10, you say, good, good, this is time for me to focus on this thing. And you know that when you're focusing on it, you make sure that there are no external factors, no phones, no social media, so that's one way we also try to focus, because it hasn't been easy. So and another thing is also to try to let the people, because we are living with the families and all of that, we also try to let them know that, okay, fine, this is my time.
Yeah. Wow. Well, I completely feel for you in those challenges, and I think a lot of us can relate to it. So kudos to you for keeping up throughout all of that. That's a lot to take on. Dr. Karode, I'm wondering if you can share some considerations that we should be thinking of in regards to faculty or university resources during these times.
Oh, absolutely. Thank you, Sean. Hi, everyone. I'm Eunice Karode from Washington, D.C. Thanks for having me, and I'm glad to be here. Actually, our transition from online format to ERT, emergency remote teaching, wasn't as challenging as some of the schools on our campus of our university, because we have had online program for the last 17, 18 years for working professionals. So there has been some preparation done for our faculty to be able to deliver the course content and also teach. So there was just a slight modification. And for that, I guess one thing that a take-home message for me is you want to survey your faculty. That is a set of question, asking faculty, have they ever done any teaching remotely? This is for university. Have they ever received any formal training in teaching remotely? What remote teaching system are they familiar with? Anything that you need to assess to see what are their needs and what resources they need. You need that information. You need to go on that information. For immediate situation, a must for ERT type of situation, time is of the essence. We spent, Dr. Tofade is witness to that, the entire spring break preparing and having meeting back to back. You want to start the training as soon as possible, but there is always a group of your faculty who have some familiarity. They are computer technology savvy. They can start doing some work. Then acquire additional resources as you are working on training faculty, laptops, PCs, personnel, stuff like that. Have a very flexible training schedule, because COVID-19 have thrown people all over the place, and people are trying to manage their time to teach, precept in some cases, attend clinics and all of that. Also assess levels of training that your faculty needs. Not everyone will need the same type of training, so you need to kind of have a different tier. What's important for me to remember is train the trainer. Pick your kind of high caliber faculty who has had some experience, train them to what needs to be done for this period of ERT, and have them train some more faculty by creating some type of training bodies online for faculty to help faculty. Then capture the trainings and have it available for faculty who want to spend time to really do their what they need to learn and what they need to do. Then for the long term, this is somewhat similar to and more applicable to planning for an online program. Holding regular meetings, having an ongoing type of SWOT analysis. What are some of the opportunities, strengths, weaknesses? Survey users, faculty and students. What are their needs? Have we met all their needs? Create and develop best practices for working remotely and share that, publish that with your colleagues, so you have some input. Then, of course, once you have that, you want to provide some guiding documents regarding resources and strategies for teaching remotely. Once that is done, provide and support the necessary training for teaching remotely. Also, same type of training and support for online proctoring. And of course,
Okay.
this would be more applicable to ERT situation
Okay.
than the online programs.
Wonderful. Thank you so much. I think that was some wonderful advice for us to consider in training our faculty for it. As we all know, not everyone is where we need to be. And so some wonderful words of wisdom, especially in regards to doing some train the trainer aspects of training. I'm not sure, Dr. Tafati, I've lost control of the slide, so I'm just going to go through and read some of the best practices. That slide was up for a little bit. We talked about training. We also heard from Ella about what she's experiencing, you know, having to work from home, sitting on a bed and learning. And I think we've all maybe experience this as we've seen students, as we've done some synchronous learning. So I think the important lesson for us all to understand as faculty members is that we need to be flexible and understanding of what our students are going through. Other things that have been mentioned is, you know, it's possible some of our students or our faculty members have friends or family members that have actually taken ill from this virus. So I think it's real important that we understand flexibility. There was a point earlier that talked about grading. One of the topics of conversation going on during these times is the potential to change to pass-fail grading. Some topics have been, should that be up to the students, and should that appear on the transcript or not if they do not pass? So those are some things to consider. I want to open it up to our audience real quickly. So I will just say I'm hoping that you have seen that there are a lot of rewards to having switched to this remote online environment, and really I'm hopeful that we can take some of these methods and use them moving forward, and maybe be able to rethink some of the ways that we have been teaching. And then of course I think an important thing is we've all been able to collaborate with each other. But now I want to open it up to the questions that have come through the chat board. So Dr. Tafati, I'm not sure if you've been able to see these, or Adlan, if you guys could open that up.
Yes. How? Wow. This is fantastic. We're seeing quite a lot of reaction from the audience. Fantastic job from the panelists and the lead panelists. Wow, about 3,500 hearts on this particular webinar. This is amazing. Wow. Thank you so much, everybody, for all that you have said and shared, and for your reaction to the webinar so far. We have lots of questions here as well, and thank you so much for joining us from around the world. One of the first few questions was around OSCEs, and I see a question here from Dr. Rula Darwish from Jordan, and asking how many students can you utilize for OSCEs, and how about larger number of students that to consider if you have a large class, for example?
So it's Beck here. I hope I'm not stealing anyone else's thunder, but over 2 afternoons we got through 50 students. We've planned the OSCE to be run in 1 full day for the 50 students for the real exam. So the practice ran across 2 afternoons. The real will run for a day for 50. In the undergraduate, which will come later in the year, we have about 200 students, and with multiple examiners and multiple cases, I have worked out a timetable that will take us 2 full days, which is not that dissimilar. It's not quite as efficient as face-to-face, but it's not that dissimilar. It's just a little bit longer than what we would run face-to-face, but I actually think it's better in the end.
Thank you so much. We also have Delina here from Albania University. Thank you, Delina, for joining us. And the question here is, we totally converted to online learning. We still have difficulty managing the laboratory section. Do you have any consideration for this? A number of other people have asked about labs, like Masha have asked about what to do in terms of labs.
Hi, this is Sarah from the CU School of Pharmacy. So just wanted to sort of address, we have also had some difficulty working through how we're going to do labs. There are some situations where we have actually done some video learning, almost like a cooking show for some of our sterile and non-sterile compounding. And then so we're giving them the information now, and we're going to do checkoffs as soon as we're able to have them in person. There's also some institutions that are bringing in, possibly, 1 to 6 students at a time, making sure that they're spread off to do sterile and non-sterile compounding, and it would just be one time where they're kind of getting checked off on their methods and given feedback. So that's kind of how we've worked around those types of labs.
Thank you, Sarah. I was going to add in, we've also used where we've had students, if they're able to go out to a clinical setting, use some practitioners to sign off on some of the skill sets, such as taking blood pressures.
Great. And somebody asked the question about OSCEs and what does that mean? And it means, let's see, objective structured clinical examination. So just so you know that. We have several questions here. I'm going to try and see how many we could get to before 9 o'clock. It looks like we might need a part 2 for this one because of the number of questions we have here. What components of the clinical skills can we consider converting into online modules in the future, and what elements can never be substituted by an online teaching method? And this question was asked by Joseph Vinod. Thank you very much for your question.
I don't know if anyone else had, one thing I would say, if you were to ask our instructional design team, they would say there's almost nothing that could not be switched to online. But I think recognizing that in the skill sets, though, I think there are some skill sets that are better served for remote or synchronous face-to-face, and those would be things like communication that are best for that. But that being said, you could use asynchronous things like recording sessions as well, or practice times. Panelists, is there anything else you guys would like to add about that?
I wonder if
yeah, this is Sarah again.
Okay, go ahead. I just wonder if they were referring to experiential.
Yeah, so I was going to chat about that real briefly. So we have actually had to set up some sort of virtual experiential activity for students that are required to have inpatient experience. And so we've allowed them to have access to online patient charts. And some of them have been in a read-only fashion, but we essentially have them look through patients, go through clinically, kind of work through assessment and plans, and then via Zoom, we do patient presentations, we do patient handoffs, we do questioning of them, and then we're also able to do presentations as well as journal clubs. So we have fairly successfully been able to run rotations with many students all at once where they are not actually present at the hospital.
Wonderful. Sarah, thank you so much for sharing that about the experiential methods that our team members have been doing. It's amazing. And with that, I'm just going to make an announcement that we are in the process of developing an experiential webinar or some other resource, likely a webinar. So please stay tuned for that, because there are a lot of challenges, but a lot of great things going on there.
Good point, good point. There's another question here, and I see we have barely a few seconds to finish this.
We got some permission to go over a little bit, Toyin, so.
Yeah, so there are a few things here that relate to addressing the new element of grace and understanding, specifically with assessments, but also maintaining rigor. Michael Thomas is asking this question about that with regards to assessing students. Who would like to take that one?
This is Sarah again, so I'd be happy to take that one. I think that there definitely has had to be a lot of flexibility with students, and I think that mainly that has worked out through if they have issues with internet connection, if they, for instance, are taking care of kids that are running around or having to do homeschooling. The big thing that's nice to be flexible with is providing multiple opportunities and also providing different time windows, and having a good open source of communication with them so you can kind of set things up well with them. But at the same time, then within that time window that you've sort of set up with them, maintaining rigor through, proctoring methods, that we've kind of previously talked about, but making sure that, sort of the rigor stands, but the timing is flexible.
Yeah.
Fantastic.
Thank you, Sarah. I was also going to add, we always have a backup plan and record your session, so someone is not able to make it, you can come up with an alternative assignment based on a recorded session.
Good point, good point. There's a question here about preparedness for faculty online. This is one of our colleagues, Dean Royale from Lebanon, is asking, how prepared were your faculty for the online teaching?
It's Beck here. I'd say they weren't prepared at all. We had about half a week to get ourselves ready for online teaching. But I am so proud of my staff because, necessity drives innovation, and we had to do it. There wasn't a choice. And yes, we had to put together some training videos really quickly on how to use Zoom and guidelines and all the rest of it. But, my students and my staff have jumped to it. We're all clever people. And whilst we may not have been ready, we're all very capable of learning, and everyone jumped to that task.
This is Eunice Howard, DC. For us, really, it was not a huge change. We just had to fine tune what we were doing before. And also just to add to previous question about students, I have learned from my experience in the last month or so since COVID-19 that our online program that is for working professionals, these students do hold a full-time job. And of course, because of the situation, their schedule have changed. They sometimes work much longer hours. And therefore, we had to kind of modify our exam times, be more flexible if they ask for extension, things of that, because in this case, our colleagues, our frontline health workers are our students. So for us, that was something new, and we were able to adjust, and so far things have gone really well.
Fantastic. I'm going to take one last question. I want to recognize that there are lots of people asking questions from Africa, Nigeria, Bangladesh, India. I thank you for your questions. It looks like we definitely qualify for a part 2, so we will make sure that that happens. But I would like to take this question from Turkey, from Gazem Gulpinar. Thank you so much for your question. And he's asking, or she, saying, can you give some recommendations about how to implement a course, including face-to-face interviews in it? How can we transform it into an asynchronous environment because we don't have enough staff to do it synchronously? How about Dan?
It's Dan Malone here from Monash University, Melbourne, Australia. Look, it's obviously a real challenge, and I certainly don't have all the answers by any stretch of the imagination, but it's a matter of following processes in terms of having good quality resources you can turn to, that you can direct students to, following that up with what you would do with lectures and trying to look at what you can have as an alternative. And we've had very short recordings which we intersperse with activities for students to take the place of lectures, and having asynchronous workshops where students work in their own time on problems that pre-developed, that students work in groups and have to come up with solutions to complex problems by working in teams. There's some of the things we've had some success at Monash University.
Fantastic. I want to thank everybody. I think, Sean, we're going to the next slide.
Yeah, and one last comment I did want to add, because the lab question I think is a really difficult challenge. And before we get to that, I just want to ask Claire Anderson from the University of Nottingham. Did you want to share about the lab in the box, your experience with that?
I haven't. Well, we had some experience earlier in Africa with it, but there is such a thing as a lab in a box, and I know that some remote courses, like from our Open University in the UK, which is a totally online university, they do send out the lab materials and the equipment to people, obviously with safety in mind, to do the experiments at home. But they've also developed an awful lot of cartoon-like or simulations of lab work as well, and that's another possibility. There's all sorts of things going on with 3D, etc.
Yeah, wonderful. Thank you for that. I can't imagine what I would do if I received a lab in a box on my doorstep, but I would do some great education with it. I did also see a website last night called Labster, L-A-B, like lobster, but Labster. I think it's a pay-for program, but it was amazing, the materials and topics that they offer. So thank you so much for that. So with that, recognizing everyone's busy schedules and all times of day, I would like to just wrap it up. And so in summary, please recall that remote and online education and assessment are two different methods, but they may overlap. And this is important to consider when we're assessing our programs and in planning for longer term delivery. We certainly have learned today many creative ways to address remote and online assessment, all of which still offer flexibility, integrity, and importantly, student learning. Our panelists shared their insight in considering both our student and faculty members' needs and shared tips to continue to provide our excellent education. We have learned that this experience may offer us ideas for improved education in the future. And then I think importantly, we have learned that our students are doing well and continuing to carry on our profession in the face of all of these challenges. So just a few housekeeping things as we move on. Wrapping up, let's see, forward, a big old thank you, importantly, to our panelists, as well as our planning committee, which of course takes was offered by multiple groups within FIP, the AIM section, academic pharmacy section, the Workforce Development Hub, and of course the International Pharmacy Student Federation teams. And importantly, thank you to all of our attendees for all of these wonderful questions. I think you've made us all think of a lot of questions, and hopefully, as Rebecca got to, we're all creative and can come up with some wonderful solutions to these. But hopefully we'll have a second session to address even more questions. Thank you for attending. There is a fourth webinar occurring this Friday, the role of regulars in addressing the WHO Patient Safety Challenge. This will be this Friday, April 24th at 1500 Central European Summer Time. Speakers will be Dr. Catherine Dugan, Dan Burns, and Anastasia Shamtanis. So we look forward to that session this coming Friday on patient safety.
And I would like to say thank you to you, Sean, for a fantastic job, and to all the panelists for all that they're doing and will do. I'm really hopeful and looking forward to part 2 of this. And thank you everybody for attending. This webinar has been recorded. You'll be able to access it on the FIP website. If you would like to be a member of FIP, please go to www.fip.org, and you will find information about membership there, and also membership for the academic institutional membership. We're so honored to have served you today, and we ask you to have a wonderful, wonderful rest of your day. Bye-bye.
Thank you, Dr. Tafati.